my father fell that Saturday. And that's when he got hurt, and the ambulance came. We took him to Morristown Hospital, and that's where it all began. From there, it went from ER to ICU to palliative care, and it just degraded as quickly as, as can be. The service at hospice was second to none. I mean, we were allowed to be there as long as we wanted. We would go home at night, and actually the nurses on shift would sit with my father and read a book that he wrote to our kids, and they would, cuddle him and do whatever they did when we weren't there. So it was amazing. It was like second to none, very satisfied.
The support that you got emotionally, physically, not just, George and I, they would take our kids and talk with them about what was going on. They supported us in every way you could possibly imagine when you're going through the most difficult time of your life.
No, my dad lives with us, so he's been with us for probably the last 10 years, but the last year has been really tough, where the immediate health decline and the loss of independence has taken its toll. It's a 2-hour window. If I tried to get my dad to physical therapy, it would be a half an hour. By the time I get him in the car, get him to the facility, get him out, wait for him, come back, do that 45 minutes to an hour. That's 2 hours out of my day that I'd rather spend with him in the evening having a nice relaxing dinner. I always felt they were aware of my father's needs even more so than I did. They would, the minute they saw him, they could do an evaluation and say, okay, I see you're doing this, but this is a whole lot more that you could be doing that would help him be more independent. They were so welcoming and open, and they just almost became part of the family the minute they walked through the door.
I think before my mom started coming here, not gonna lie, we were in a dark place. It was tough. We knew that she needed some type of help, but we didn't really know what that help was. We didn't know what we needed to do. And luckily her doctor, primary care doctor, made a suggestion about this center. From the very first day we brought my mom here, it was, I had a little trepidation about, would she come in and say, this is a senior center. I don't want to be at a senior center. I just retired from teaching at college. And it was the complete opposite. She was immediately engaged in the activities, the singing, the dancing, the music, the art, the gardening, you name it, they do it here.
He has works and he comes bring me in the morning and then takes me home. And I loved it that he did this for me.
We want caregivers to know that they're not alone, that our dedicated team of nurses, physical therapists, social workers, home health aides are there to help you, support you in the day-to-day caregiving that you do. But the most important thing is for patients to be able to remain in the community, remain in the homes, which is where people want to be. They don't want to be in a hospital or nursing home. They want to be in their home with their loved ones, doing what they want to do. And that's what we help them to do.